Welcome back to Rohrich Knose Podcast 2025. It's the era of AI, and we're going to do something very unique. We're going to do an AI-generated podcast in YouTube, and this one's going to be on tip shaping. And what we've done here is we've fed Google-based AI some articles about tip shaping and rhinoplasty, and there'll be a dialogue on the development of columnar struts versus septal extension grafts. And this is totally AI generated, so it really gives you a very good focus on what's the future, and I think, let's roll with it. So I'm going to tell you a little bit about, why this is such an important concept of tip shaping and rhinoplasty. And obviously it's all about tensioning and tip shaping and the evolution of tip support, and the AI will actually talk about the evolution of that from columnar struts to septal extension grafts, and why columnar struts were so powerful, but they were limited in what they could do. And here's a great example of a patient that actually had a columnar strut. She had good tip shape and contour, didn't need much rotation, very deviated nose. And here she is after her surgery with a columnar strut, which is a floating piece of cartilage between the columella, and why it worked so well for this beautiful patient. And of course, it has a great result from the base view as well, to even the use of long-term results in these patients that had a columnar strut out to 25 years, that shows beautiful types of shape and contour that didn't need much rotation or tip changes. And so, but why does it not work for all patients? And I think it works great to maintain tip projection or rotation, but it doesn't work to increase it or decrease it. In essence, it's being unreliable, and so it doesn't offer any rotational control. And so we use columnar struts when you have a good, strong lower lateral cartilage. But if you want to increase tip projection or rotation, it doesn't work well. Hence, the evolution of tip shaping with a septal extension graft. And this is really the articles that I fed into the Google AI, and actually was the basis for this podcast. And it really talks about the development of a septal extension graft, the fixed mobile septal extension grafts, how it's important to use tip shaping for this, the sutures that you have to use to do that, and how then you could actually restore beautiful tip shape and contour and give you good results, like in this beautiful lady that needed tip rotation upward, removal of her dorsal hump, and refinement of her tip. So using a columnar strut in contrast to using a septal extension graft in contrast to a columnar strut gave her a beautiful result, because we wanted to rotate the tip up and increase tip projection, something that a columnar strut doesn't do well. So that's the evolution and the summary of really this AI-generated podcast, because what you're doing is you're using the framework to push up and to redrape the skin around it. And really that gives you the result that you want. And in this case, the tip shaping. The tip shaping is the gold standard. It gives you a beautiful tip, softens the nose, and really enhances her innate beauty that she has as a female, and really is the power of a septal extension graft. So I would say, let's go and listen to this AI-generated podcast about the evolution of tip shaping from columnar struts to septal extension grafts, and give me your thoughts and comments to see if it was helpful or educational, and see how it can be improved.
Have you ever noticed how the slightest imperfection can totally throw off your whole look?
Yeah.
Even something small, like a tiny bump on your nose.
Oh yeah, absolutely.
Today, we're going deep into the world of rhinoplasty.
Okay.
To uncover how surgeons are achieving these natural-looking results that actually last.
I think that's what everybody wants, right?
Oh yeah.
Natural and long-lasting.
For sure.
It's fascinating how this field is constantly evolving, especially when it comes to tip support.
Yeah.
We used to rely heavily on columnar strut grafts, but there's been a noticeable shift towards septal extension grafts.
Okay, so let's break that down for our listener.
Sure.
What exactly are these grafts and why the change?
So if you imagine you're building a house,
Okay.
you need a strong foundation, right?
Right.
And rhinoplasty tip support is like that foundation.
Got it.
It's what keeps everything in place and prevents the tip from drooping or changing shape over time.
So the columnar strut graft was like the go-to foundation for a while.
Yeah. Exactly. It's a piece of cartilage that's strategically placed between the medial crura, which are the inner parts of the cartilage that make up the tip of your nose. So it acts like a little pillar
Okay.
holding things up.
Okay, so then the septal extension graft.
Yeah.
That's like an upgrade to that foundation.
Yeah, you could say that.
Okay.
It's a different approach that uses cartilage from the caudal septum,
Okay.
which is the lower part of the wall that divides your nostrils.
Gotcha.
This graft is shaped like a keel of a boat,
Okay.
mimicking the natural curve of the middle part of the tip cartilage.
I am sensing this is where things get really interesting.
Yeah.
Why the move away from the columnar strut?
So there's a few reasons.
Okay.
Surgeons are always striving for those more natural-looking results.
Yeah.
And the columnar strut, while effective, could sometimes create like a slightly stiff or unnatural appearance, especially if it was too bulky.
So this shift is all about subtlety and creating a nose that like moves and looks natural.
Precisely. The septal extension graft is a much more refined technique.
Okay.
It's placed in a way that allows for more natural tip movement while still providing that essential support.
And I'm guessing there's some science to back up this shift in technique.
Absolutely.
Okay.
Dr. Rohrich, he's a renowned plastic surgeon. He has been a pioneer in this area.
Right.
He's conducted extensive research comparing the long-term outcomes of both techniques.
Okay, this is where I get excited.
Okay.
Tell us, what did Dr. Rohrich's research reveal?
His studies have shown that septal extension grafts tend to be much more stable over time.
That makes sense.
They have significantly less projection loss, meaning the tip is less likely to droop or lose its definition.
That's huge. I mean, who wants to go through a rhinoplasty?
Right.
Only to have their nose change shape a few years down the line.
Exactly. And the research also found that septal extension grafts are particularly beneficial for men, who tend to experience more projection loss with columnar strut grafts.
Wow. I'm starting to see why this is such a game changer.
Yeah.
So it's not just about aesthetics.
Right.
It's about achieving results that truly stand the test of time.
Exactly. And that's why Dr. Rohrich has been such a strong advocate for septal extension grafts.
Makes sense.
He's even developed a specific technique called the fixed floating technique to further enhance the natural look and feel.
Fixed floating. That sounds intriguing.
Yeah.
Can you break that down for us a bit more?
Sure.
What makes this technique so special?
Well, Dr. Rohrich's fixed floating technique, it's all about striking that perfect balance between stability and flexibility.
Okay.
It's like a carefully choreographed dance, ensuring the graft stays put while allowing for natural movement.
Okay. I'm picturing this dance in my mind, but I need you to break it down for me like step by step.
Okay, sure.
How does it actually work?
So picture the septal extension graft. That keel-shaped piece of cartilage being gently secured to the caudal septum.
Okay.
That's the lower part of the wall between your nostrils.
Gotcha.
On one side only.
So it's anchored on one side but not the other.
Exactly.
That's where the fixed part comes in.
Exactly. And here's where the floating magic happens.
Okay.
The other side of the graft isn't fixed at all.
Cool.
It's carefully positioned so that it hovers above the anterior nasal spine, which is a bone in prominence at the base of the nose.
It's almost like it's suspended in midair.
That's a great way to visualize it.
Wow.
It's held in place with strategically placed sutures,
Okay.
almost like tiny threads, creating a delicate web of support.
So it's secure, but it's not like rigidly fixed in place.
Exactly. And that's the genius of it.
Yeah.
This floating aspect allows for a subtle, natural movement of the tip
Okay.
when you smile or talk or even just breathe.
So no more frozen nose look.
Precisely the goal is to create a nose that harmonizes with your face, not one that looks stiff or artificial.
I'm sure our listener is curious. How did Dr. Rohrich come up with this technique?
Yeah.
Was it like a sudden aha moment?
Yeah.
Or years of meticulous research?
It was a culmination of both, really.
Okay.
Dr. Rohrich has dedicated his career to advancing the field of rhinoplasty. He's constantly pushing the boundaries, searching for ways to improve outcomes and enhance patient satisfaction.
It's inspiring to hear about surgeons who are so passionate about their craft.
Absolutely.
Yeah,
And his fixed floating technique is a testament to that dedication.
totally.
He recognized that the traditional approaches, while effective, sometimes fell short when it came to achieving truly natural-looking results.
So he saw a need and decided to innovate. I love that.
Yeah.
But it wasn't just based on intuition, right?
Right.
He actually put this technique to the test.
Oh, absolutely. He conducted rigorous studies
Okay.
to compare the long-term stability of his fixed floating septal extension grafts with the traditional Collier-Meller strut grafts.
Okay.
And the results, as we touched upon earlier, were quite remarkable.
Remind our listener what those results were.
Yeah.
What made those septal extension grafts stand out?
So the studies showed that patients who received septal extension grafts, specifically using the fixed floating technique, experienced significantly less tip projection loss over time.
All right.
This means their noses were much more likely to maintain their shape and definition for years to come.
So it's not just about looking good right after surgery.
Right.
It's about those long-term results.
Exactly. And what's even more fascinating is that these studies involved a diverse group of patients, including men and women with varying degrees of tip projection needs.
So it wasn't just a small sample size or like a specific type of nose. This technique seems pretty versatile.
It is, and that's one of the reasons why it's gaining so much popularity in the rhinoplasty world.
That makes sense.
It's not a one-size-fits-all approach,
Right.
but it's adaptable to a wide range of anatomical variations and desired outcomes.
Now I'm picturing our listener frantically taking notes,
Yeah.
wanting to ask their surgeon all about this fixed floating technique.
As they should.
Right.
It's always a good idea to be an informed patient.
Absolutely.
Understanding these nuances can help you have more meaningful conversations with your surgeon and make decisions that align with your goals.
So what are some key takeaways for our listener when it comes to Dr. Rohrich's work and this evolution of rhinoplasty techniques?
Well, it's been fascinating to learn about this evolution in rhinoplasty and how surgeons are constantly refining their techniques.
For sure. But knowing what we know now, what should our listener keep in mind when considering rhinoplasty?
Well, first and foremost, it's crucial to understand that rhinoplasty is not like a one-size-fits-all procedure.
Right.
It's a highly individualized surgery
Okay.
that requires a deep understanding of nasal anatomy artistry and a keen eye for detail.
So finding a skilled and experienced surgeon is absolutely essential.
Absolutely. You want someone who has a proven track record with septal extension grafts.
Okay.
Specifically, Dr. Rohrich's fixed floating technique,
Right.
if that's something you're considering.
Yeah.
Don't hesitate to ask for before and after photos of their patients,
And that's always a good idea.
just to get a sense of their aesthetic style and the kind of results that they achieve.
And it sounds like open communication is key here.
Yeah.
Our listeners should feel comfortable asking their surgeon all sorts of questions, right?
Absolutely. It's your nose, your face, your decision.
For sure.
You should feel empowered to ask about the surgeon's experience,
Yeah.
their approach of the potential risks and benefits, and what to expect during the recovery process.
Speaking of recovery, what can our listener anticipate after rhinoplasty?
Well, recovery varies from person to person.
Sure.
But it's important to be prepared for some swelling, bruising, and discomfort.
Okay.
You'll likely have to wear a splint for a week or two
Okay.
to protect your nose and help it heal properly.
So it's not exactly a walk in the park,
Right.
but it's manageable
Right.
with the right care and guidance from your surgeon.
Exactly. And the good news is that with advancements in techniques, like the fixed floating septal extension graft,
Right.
recovery tends to be smoother and less complicated than it used to be.
That's reassuring to hear.
Yeah.
So as we wrap up this deep dive,
Yeah.
what's the one message you want to leave our listener with?
Well, I'd say this. If you're considering rhinoplasty,
Okay.
don't be afraid to do your research. Ask questions
Yeah,
and advocate for yourself.
absolutely.
Find a surgeon you trust. Discuss your goals openly
Yeah,
and explore all the options available to you.
totally.
With the right approach, you can achieve natural-looking results that enhance your beauty and boost your confidence for years to come.
I love that. Well said.
Thank you.
It's been a fascinating journey exploring the world of rhinoplasty.
Yeah, it has.
From those foundational Collier-Meller strut grafts to the innovative fixed floating septal extension grafts.
Amazing.
Yeah, and it's a testament to the dedication and ingenuity of surgeons like Dr. Rohrich, who are constantly pushing the boundaries of what's possible.
Absolutely.
And remember, Dear listener, knowledge is power.
It is.
The more you understand about the procedures you're considering, the better equipped you'll be to make informed decisions that align with your unique needs and aspirations.
I agree.
Well, it's been a pleasure having you.
It's been a pleasure being here.
And thank you for joining us on the Deep Dive.
Of course.
Until next time, keep exploring.
Yeah.
Keep learning and keep diving deep.
Sounds good.
Wow, what did you think of this amazing dialogue that was AI generated? I thought it was quite interesting and very impactful, and it really seemed to flow well. But I need your comments, your thoughts on how we can incorporate this into our podcast and other podcasts in the future to make them not only educational, but powerful and impactful. So give me your thoughts, give me your comments, and DM me if you have any other comments. And until next time, you won't have an AI, but you'll have me. Take care.